Careblazers, today we are talking about dementia and anesthesia. Does anesthesia cause dementia or increase your dementia risk? So many of you have told me stories about your loved one with dementia seeming to do worse or having more problems with their thinking after receiving anesthesia of some type. I want to show you what the research shares. I also want to share you my personal opinion of why the research is confusing and might not be sharing the full picture. First of all, let's talk about what anesthesia is. Anesthesia is a group of medications that are used to stop the pain signals from going to the brain so that the brain can't detect the pain signals. And there's different types of anesthesia. So we have local anesthesia, which is used in more minor procedures where it can numb a certain area. And then we have regional anesthesia where it can numb a bigger area and block the pain from happening. For instance, the type of anesthesia that might be given in a C-section. We also have general anesthesia. This is what we think about when the person is totally under and unconscious. There's also more sedation where the person is actually unconscious but communicative, like they're not totally under. They'd still be able to communicate even though they might not be able to remember the actual procedure. So different types. What does the research say about those types of dementia? This has been studied quite a bit, long ago and even recent studies, because many clinicians and healthcare providers alike are wondering, are we sure anesthesia isn't causing dementia? Well, despite all the research being done, the general consensus and conclusion among all of the research is that no, anesthesia does not cause dementia. However, this is my thought process and what I want to share with all of you and what you might be noticing. Anesthesia often causes something called delirium. Specifically, if it's after anesthesia, after a procedure, it's called post-operative delirium. We've talked about delirium here on this channel before. It's an increase in confusion caused by some underlying condition. In this case, we're talking about anesthesia causing that increased confusion, but delirium can happen from many other conditions like medication side effects, dehydration, a UTI, and obviously anesthesia. So this increase in confusion from post-operative delirium is quite common. In the general population, so people, healthy population, you and me and people without dementia, delirium after a procedure affects about anywhere from 10 to 50% of people, meaning when you come out and you start coming to, you're increasingly confused. But when we take a look at people who have dementia, their risk of post-operative delirium is 89%, meaning there's a really good chance if the person with dementia receives anesthesia, they are going to become more confused. Now, delirium, treated and given some time, ideally goes away for most people. So if you and I were to have a procedure and have delirium, chances are it would start to wear away and we would go back, ideally, to our normal way of thinking. However, for people who have dementia or cognitive impairment, when the delirium clears and goes away, they might not go back to their baseline level of functioning. It's as if they don't go all the way back to the way that they were. Their brain has taken a hit. A study looking at over 10,000 people found that those who experienced delirium had a higher risk of developing cognitive decline. In fact, the people who experienced delirium, their odds were 2 times greater of developing long-term cognitive decline. Now, this was true for people who developed delirium because of a surgery, where they received anesthesia, but also either if the person didn't have surgery, they developed delirium from something else like a UTI, dehydration, medication side effects. So regardless of anesthesia and regardless of surgery, delirium itself increased the chance for cognitive impairment down the line. This research highlighted that having a delirium episode not only increased dementia decline for people who already had pre-existing cognitive problems, but it also increased the risk for cognitive decline for people who did not have any pre-existing cognitive problems. So for me, the issue I have with the research that states anesthesia does not cause cognitive decline is it's kind of jumping over the part and the piece that even in the normal population, about 50% of the people can experience post-operative delirium. And when we start talking about older adults with dementia or other just medical conditions, their chance of delirium is even higher, up to potentially 89% of people develop delirium. And delirium is a risk factor for developing dementia. So I am wondering, based on all the comments many of you reach out and tell me about, if that might be what's going on with your loved one, whether they were already starting to show problems with their thinking or they had no problems with their thinking at all, they underwent some sort of anesthesia, had some sort of confusion coming out of the anesthesia dementia, what we would consider a delirium, and that increased their risk for cognitive impairment. That would just be my guess. I have linked below some articles, including the study that I referenced, if you want to dive into the science. Now, if you are caring for a loved one with dementia, whether it was caused and increased from anesthesia or not, you are invited to check us out in our care course, where we come together every single week with support groups, Q&As, live events, and just a beautiful community. And we figure out, well, what do we do now that our loved ones have dementia? How do we care for them in the best way possible? Make sure we're making the best decisions possible, and we care for ourselves in the process. That link is below. I look forward to hopefully meeting you and working with you further in the care course. I am sending you so much love. Bye.
Also, Nico gets a belly rub for every person who subscribes from this video. So if you haven't already, click the red subscribe button. It's totally free, and Nico says thank you very much.